Hi, I'm Steve, student nurse on Western Sydney. Welcome back to my channel. So today I want to talk about Crohn's disease, and why we need to know about the Crohn's disease topic. It's important because many people didn't know they have Crohn's disease and living with Crohn's disease, and then the symptom hits them back like when they get older. So the audience can recognize the diet factor and having prevention cares to seek health screening and intervention on time. And I hope this video will be help educate people to understand the impact of Crohn's disease. And according to Crohn's and Colitis Australian Organization, they reported that 180,000 Australians living with Crohn's disease, and it is expected to rise in the future. So the number is huge, but we need to investigate why Crohn's disease is so popular in Australia. So first, I want to talk about the aims of Crohn's disease, include the definition, the etiology, the symptoms, the risk factor, pathophysiology, the diagnosis, the treatment, and preventative cares in this presentation. So let's get to know the definition of Crohn's disease. Again, Crohn's and Colitis Australian Organization define Crohn's disease as an autoimmune disorder in which the immune system um, become resistant to pyretic sensation or the heat sensation due to inflammation, and the goblet cell attack their own visceral organ by overproducing chemical substances during the inflammatory response. So in this case, Crohn's disease is a chronic type of inflammatory bowel disease, and it classified as autoimmune disorder. So what is autoimmune disorder? So the word autoimmune refers to alteration of the immune system against its own function. So in this case, autoimmune disorder when antibody production attacking its own cells. And Crohn's disease is an autoimmune disorder. It affects several parts of the lower and upper gastrointestinal tract, and from the small intestine to large intestine, and then to the rectum. So any part of digestive system, and commonly affect the ileum, duodenum, and large intestine, the second part. And similar to diverticulitis, Crohn's disease is commonly affects the ascending colon, the right side, transverse colon, descending colon. But it's different to ulcerative colitis because Crohn's disease affects the entire bowel, gastrointestinal tract, any part of the digestive system from mouth to anus. But the ulcerative colitis affect only the lower gastrointestinal tract, and both share inflammation effects. So what is the etiology of Crohn's disease and how this causes? So Crohn's disease, known as spread granulomatous colitis or regional enteritis, is an inflammatory bowel disease, affect any part of the digestive system. It is incurable, which means there's no complete recovery after treatment. Normal resulted in repeated surgical resection or intense medical therapy. Usually when you undergone when we underwent any some sort of intense medical therapy or surgeries, then Crohn's disease can happen or can trigger the patient. Um, and high risk to serious complication, comorbid to sepsis, hemorrhages, perforation, fistula, abscess, and obstructions. So what are the symptoms of Crohn's disease? It's classified into two types: gastrointestinal tract symptoms, the general symptoms, and systematic symptoms, also known as internal symptoms. Gastrointestinal tract symptoms include inflammation at the ileum, like ileocolitis, gastroduodenal Crohn's disease, like causing weight loss, vomiting, nausea, jejunal ileitis, like inflammation to small intestine, diarrhea, um, fistula or fake tunnel. Crohn's colitis causes rectum bleeding, anus bleeding, ulceration, skin lesions, and joint pains, loss of appetite, mouth sores, perineal problems like anus inflammation, perineal fissures like anus tracts, nausea and vomiting, goiting pain, abdominal cramping as well. And systematic symptoms or internal symptoms include fatigue, where inflammatory response, it seduces the central nervous system, and fever when blood loss, electrolyte loss, water loss due to infection, anemia when red blood cell loss, and that's when trigger anus bleeding and internal bleeding of the intestinal tissue as well. That's when there's some part that people have diarrhea with blood. Um, and anemia when there's a deficiency of iron, deficiency, nutrition, water loss, etc. Arthritis, again, abdominal lining causing joint pains, and eye inflammation as well, skin allergies, delay in children's development, kidney stone, liver problems, strictures present, and breast stenotic dilation. And these are all internal symptoms related to Crohn's disease. It's systematic. It happened inside. So what are the risk factors of Crohn's disease? So the risk factor of Crohn's disease includes unhealthy diet of hard solid foods, or junk food, and any diet like burning, causing burning sensation to gastrointestinal tract. Avoiding eating guava fruit at night time. And obesity links to when you have late dinner before having late shower. So already have late dinner before having late shower, and then go to sleep immediately after dinner. That will cause gradually weight gain, indigestion problems, and obesity related. Prolonged physical inactivity, dehydration when minimum water intake, smoking and alcohol also risk factor, ignorance behavior like having perception that Crohn's disease is not a big problem, and avoiding treatment or screening, and bowel infection can trigger Crohn's disease as well. So what is the pathophysiology of Crohn's disease? The pathophysiology of Crohn's disease occurs when the malfunction of the immune system activates the inflammatory response to produce goblet cells like T cells, helper T cells, B cells, macrophages, and neutrophils. Those are when immune system trigger and those cells activate against pathogens. Then the direction of this action increases the goblet cells, like it overproducing the goblet cells, but in turns it reduces the mucin gene production. Those mucin gene production include MUC1, MUC2, MUC3, MUC4, and MUC5B. And those mucin gene function to release chemical like histamine, prostaglandin, bradykinin to ingest pathogens. However, the lower of mucin production, the higher susceptibility to infection due to the decrease of hemostasis and a reduction of mucosal layer. So constantly, the more chemical release, the more immune resistant to the inflammatory response. And immune system is dysregulated and it elevated pyretic sensation to increase the vascular permeability to improve luminal inflammation inducing toxin susceptibility. And that's how the pathophysiology of Crohn's disease is explained. So next, let's go to the diagnosis. The diagnoses are pathology and radiology. So pathology, we do the blood test to observe sign of anemia or mineral deficiency, to check for the full blood count or complete blood count, FBC or CBC, to check for anemia and bleeding. CMP refer to comprehensive metabolic panel to check general health like metabolic conditions, and then CRP refer to C-reactive protein, it to scale the inflammatory bowel disease level. And ESR refer to erythrocyte sedimentation rate. It's to scale inflammation level to observe in sedimentation level. That means the higher level means severe inflammation. Fecal occult blood and fecal immunochemical tests to observe blood in the stool. Urinalysis to observe infection sign or bacteria infected in the urine culture. Then the stool test to observe calprotectin biopsy, fecal lactoferrin, ESR-C reactive protein to observe any inflammation, infection, signs of types of bacteria infected in the stool test, stool culture. And then radiology involves X-ray, CT abdomen scan, capsule, MRI, and intestinal ultrasound to capture the image. Endoscopy, camera inserted from the mouth down to the esophagus and to the upper gastrointestinal tract after the sedation to capture the image. Laparoscopy, small incision suppository into the rectum, and to capture the image, similar to colonoscopy, camera inserted into the rectum as well. So what are the treatments for Crohn's disease? The treatments include medication and surgery. So let's talk about medication, corticosteroid to reduce gut inflammation and hemorrhages or bleeding, immunosuppressants like it has toxic level is high, so it inhibits the immune system against over hyperactive or anti-inflammations, and biological agents to reduce gut inflammation and swelling. Again, anti-inflammatory drug or NSAID drugs, it stop the inflammation. And antibiotic like probiotic, it produce good bacteria and prevent bacterial infection, colonic bacterial infection. Opioid analgesic for pain, antiemetic to reduce nausea and vomiting, as shown in the symptoms. Fluid and electrolyte to prevent dehydration because of the diarrhea. People tend to have blood loss or water loss. And consider those in these medications with the low dose adjustment and light dose and drug interaction as well. The surgery, there's so many types of surgery, but let's discuss one by one. Colectomy, it's the colon removal surgery to prevent colon cancer, usually done for those with chronic ulcerative colitis or chronic Crohn's disease. Bowel resection surgery to remove damaged tissue to treat fistula and relieve bowel obstruction. Strictureplasty surgery, removing part of the intestine. Proctocolectomy, remove the entire colon and the rectums for ulcerative colitis. But for this case, Crohn's disease also affect any part of the digestive system, which means it also affect the colon and the rectums. So proctoclectomy also suitable for those with chronic Crohn's disease as well. Small bowel resection remove the small intestine. Fistula repair to remove or drain fistula and treat fistula that doesn't heal with medication. Then ileocystectomy remove the small intestine or large intestine. They remove the cecum, the ileum, and the appendix to treat chronic Crohn's disease. So what are the preventative cares? Again, diet is the most significant factor to prevent Crohn's disease. In this case, elemental enteral diet is a combination of building blocks of food that easily digestible. Elemental enteral diet allow the bowel to rest. Elemental diet can in forms of liquidity, and it's a source of amino acids for bodybuilding. Example, carbohydrate, fats, milk, soys, beans, oats, calcium, etc. Non-elemental diet like solid foods are source of protein and oligopeptide for energy giving. Example of red meat, but in a sufficient amount or appropriate amount of consumptions. Polymeric diet like source of protein for immune boosting. Example of vitamin or supplement. Protected diet includes source of natural plants for immune system protection and digestion improvement. Example of vegetable, fresh fruit, grains, seeds, water. And it's important that we can discuss if we're spotting experience those symptoms, discuss with the GP, doctor, dietitian, nutritionist, the nurses, etc. Avoiding holding voiding frequency or urgent voiding, encouraging water intake and physical exercise. Some medication side effect causing constipation ensure that prevent constipation. If there's some medication like non-opioid analgesic can cause constipation. So Crohn's disease, constipation can trigger severity of the Crohn's disease. So that's why these are all the basic preventative cares and pretty much it. And references available upon request. Thank you for watching. If you like and subscribe to my channel for more. Thank you and see you in the next one.